All babies cry, but some babies cry more than others. And these babies who cry extra and get really fussed and very inconsolable, we call them colicky, and we say they have infant colic, and about 5 to 19% of babies have that. Parents filled out this survey answering questions about their babies and some features of their baby's behavior as well as their own health, including things like whether or not they had migraine. And what we found is that mothers who have migraine are indeed more likely to have a baby who has colic. Interestingly, fathers who have migraine are not more likely to have a baby with colic. So we're still trying to figure out exactly why that's different. But going back to the mothers, those who have more frequent migraine, over 15 days per month, are more likely to have a baby with colic. So for every 10-day increase in headache frequency, there's an increase in risk of having a baby with colic. I think there's a couple of key takeaways for the clinician. One, if you are taking care of a pregnant woman who has migraine or a woman who's planning pregnancy, counsel them about colic. Tell them that they may be at increased risk to have a baby who has colic. Explain what that means, that it's a transient thing, it's self-limited, it's not going to be there forever. And then maybe plant the seed that it's not necessarily something that's coming from the baby's feed. So they don't necessarily need to send themselves crazy buying new formulas or changing their own diet if they're breastfeeding. Maybe just like they have migraine and are sensitive to stimuli, maybe their baby feels the same way, and they could best be helped by turning down the lights, turning off loud noises, limiting the number of people in the room. So just giving them some anticipatory guidance about what they might encounter when their baby is born. And then a little further down the line, if you're a pediatric clinician and you're seeing a child who has a history of infant colic and now they're coming into the office saying that they're getting recurrent headaches, think migraine. Think, okay, that was maybe an early marker that you were a kid who's more likely to develop migraine, and now you're coming in with symptoms that do make me think migraine, and don't blow that off. Make sure that you make that diagnosis and offer them appropriate treatment for migraine. I mean, the worst of infant crying and colicky crying included is around 5 to 6 weeks of age for the baby. So crying in the first couple of weeks may not be too much, but then it does tend to ramp up over weeks 3 and 4, peaking around age 5 or 6 weeks, and then it does start to come down. So it doesn't get worse than that. And it starts to come down over the next few weeks, and by about age 12 weeks, usually the colic has settled out. We don't know exactly what proportion of babies who have colic actually go on to develop migraine, and by what age. Is it by age 5, by age 7, by age 9? And if you had a prospective pediatric registry that followed thousands of babies through their childhood and ideally into adolescence and early adulthood, then we could start to answer those questions. What proportion actually develop migraine, and at what time point and at what severity? And I think those are the kinds of questions that parents would really want to know, and it might tell us where we could intervene. If we know which little ones as young as babies are at really high risk for developing chronic migraine, for example, by the time they're 10, those are the ones that we should be getting into pediatric headache specialists absolutely at the earliest possible time point, treating as early as possible, trying to change the course of their disease trajectory. And so I think that information would potentially really help us. We know about this relationship between migraine, particularly chronic migraine and infant colic, and that we think it's genetic and hereditary. Hopefully that can destigmatize it for the mother and make her not feel like it's something that she's doing wrong in raising her baby, or something about her baby not connecting with her, and maybe that will actually be helpful for a mom to hear that this is expected, this is not something that you're doing wrong in the way that you're interacting with your infant. So hopefully it would be reassuring. And then I think helping prepare that infant colic is a time-limited phenomenon. It's not like the baby's going to be fussy forever. It's going to pass after the first few months, and so just have to get through that time period, and maybe we can use some techniques of dampening down stimuli rather than changing formula and diet and all those sort of things, which might be more stressful to the family, and maybe that will help them getting through that time period.